everyone, welcome to Eklavya Overseas. This is Purnima Chauhan, and in this video I'm going to discuss in detail about the impact of NMC Gazette on MBBS in Russia. So as we all know, since it's not today's topic that we have come to know that NMC notification has released. It was released in 18th November 2021 and we all are familiar about its guidelines and the points the National Medical Commission have mentioned in the Gazette, in their official Gazette notification that has released on 18th November 2021. So talking about this NMC Gazette notification, it has affected many countries and abroad in some or other way. So first of all, I would like to clarify in the beginning itself that what its purpose and how and why NMC has come up with all the clause that has mentioned in their official Gazette notification. So first of all, it has come into picture for the permanent registration for the foreign medical graduates in India. This is the most important thing that came into picture during this NMC Gazette notification. So it has clearly emphasized on the permanent registration of foreign medical graduates in India when they pursue their MBBS from abroad, and once they return back they need to have a permanent registration, and for that the NMC has given certain clause. So now moving ahead, I would like to discuss in detail regarding all the clauses. So first of all, this video is entirely dedicated towards the impact of NMC Gazette notification on MBBS in Russia. So we are talking about Russia only in this video. We are not covering any other countries, although it has affected all the countries in general. So talking about Russia, as we all know, the pattern of education that Russia follows is of ECTS, which is European Credit Transfer System, and the duration of ECTS credit will be 360 credit points that you have to cover during your MBBS years, and minimum it takes 6 years to complete your MBBS degree in Russia, which clearly satisfies the NMC notification. One of the clause in the NMC Gazette notification that states the minimum duration of MBBS in abroad should not less than 54 months. So the duration is completely satisfies the NMC clause that it should be of 6 years. In Russia, the duration can be or cannot be less than 6 years. It includes 5 years of MBBS and 1 year of internship. Now coming towards the internship, that NMC has stated the internship should be mandatorily completed in the same country or in the same university as well, wherein a medical student has completed their MBBS. So the final year of internship has to be compulsorily done from the same country and with the same university itself. It cannot be done to any other country, or the migration cannot be possible as per the NMC Gazette notification. So you need to have all these things in your mind as far as your duration is concerned, as far as your internship year is concerned. So if we talk about MBBS in Russia, all medical universities have the structure of 5 years of MBBS, and last 1 year is dedicated to the clinical internship. So now, apart from this, there is another clause that they have mentioned is about the language. As we all know, Russia is not an English speaking country. The medium of instructions will be of English in many universities, but as we all know that some universities in Russia, they follows the bilingual pattern, which is no longer valid in India. So you need to choose wisely the university that you are going to pursue your admission, your MBBS from Russia. It has to convey or it has to give you the medium of instructions fully in English medium or in English curriculum. So as per the NMC Gazette notification, you should not pursue your MBBS in any bilingual university wherein they teach 3 years in English and 3 years in Russian, which is not at all valid in India any longer from 2021. So language is the medium of instruction, which is very important that you should keep in your mind that it should be completely or entirely in English. So in that regards, NMC has also asked the medical universities in Russia about their medium of instructions, and it has to be in English only. Apart from the language of instructions, the duration of MBBS, the internship year, they have also asked students to get license to practice, and for that you need to pass the license exam that will be in local language. So apart from your MBBS curriculum, you should learn the Russian language thoroughly to complete your clinicals, and along with that you need to also clear the license exam, which will be in Russian language. So all students who are willing to take admission in Russia, or the students who have already taken admission after 18th November 2021, this NMC Gazette notification has been implemented to all the such students. So you should keep in mind that choose a medical university wisely, wherein you will get the teachings in English medium throughout from first year to sixth year, wherein you will get good clinical rotations, wherein the faculties should be very good so that you can prepare for next exam. So talking about the next exam, they have also given a bit clarity on the next exam and how it has to be conducted in India. So for example, if you completed your education MBBS 6 years in Russia, after completing the MBBS in Russia, you need to get your clinical license or the license to practice in Russia. After that, you can come back to India, you can write next one, and after writing next one, you have to do mandatorily 1 year of internship in India, which is compulsory or which has become compulsory as per NMC Gazette notification. And after that, you need to pass next 2 exams, then only you will be able to get a permanent registration here in India. So these all are the main clauses that NMC has put up in the NMC Gazette notification dated 18th November 2021. So I completely agree that it has created too much of dilemma amongst the students who are willing to pursue their MBBS from abroad. But yes, we cannot deny the fact that many students, or 80% of students, do not cope up with the education in India just because of the cost factor involved, because of the high cost involved in the private medical universities in India, and hence they are choosing or willing to pursue the MBBS in abroad, which is ultimately, or which is definitely a good option to pursue. And Russia, I would say, is one of the best country for such students who are not financially well or who cannot afford the studies in India, especially in the private medical universities. So my suggestion is you can definitely go ahead by choosing study MBBS in abroad, because all the clauses are fulfilled, all the NMC clauses have been fulfilled by the medical universities in Russia. There's only one thing which you need to focus is the right medical university. So for that guidance, you can definitely call Eklavya Overseas on the contact numbers mentioned below. You can also follow us on Instagram for the detailed update about MBBS in abroad, especially about MBBS in Russia. And you can also drop your comment if you have any queries related to the point that we have covered in this video about impact of NMC Gazette for MBBS in Russia. I hope you have liked this information. Do like, share and subscribe our YouTube channel Eklavya Overseas.